If you're one of the millions of people who suffer from chronic bronchitis, you know how debilitating it can be when those symptoms suddenly worsen. That's where Omnicef comes in. This powerful antibiotic has been proven effective in treating acute exacerbations of chronic bronchitis, providing relief and helping you get back to normal life faster. Omnicef works by targeting the bacteria responsible for the infection, effectively killing it off and reducing the severity of symptoms. With its broad spectrum of activity, Omnicef is able to combat a wide range of bacterial strains, ensuring you receive the best treatment possible. Whether it's a persistent cough, difficulty breathing, or excessive mucus production, Omnicef can help alleviate these symptoms and improve your overall quality of life. Its fast-acting nature means you can start experiencing relief within days, allowing you to get back to doing the things you love. Consult with your healthcare provider to see if Omnicef is a suitable treatment option for your acute exacerbations of chronic bronchitis. Remember, only take antibiotics as prescribed and complete the full course to ensure the infection is fully treated. What is Omnicef and how does it work? Omnicef, also known by its generic name cefdinir, is part of a class of antibiotics called cephalosporins. It works by targeting the bacteria responsible for the infection, effectively killing it off and reducing the severity of symptoms. Omnicef has a broad spectrum of activity, which means it can combat a wide range of bacterial strains commonly associated with acute exacerbations of chronic bronchitis. The mechanism of action of Omnicef involves interfering with the synthesis of the bacterial cell wall, leading to the death of the bacteria. This targeted approach helps to eliminate the infection and alleviate the associated symptoms. Omnicef is available in both oral suspension and capsule forms, making it convenient and easy to administer. Acute exacerbations of chronic bronchitis, causes and symptoms. Chronic bronchitis is a long-term condition characterized by inflammation of the bronchial tubes, which carry air to and from the lungs. Acute exacerbations, also known as flare-ups, occur when the symptoms of chronic bronchitis suddenly worsen. These exacerbations are often triggered by respiratory infections, such as bacterial or viral infections. The symptoms of acute exacerbations of chronic bronchitis can vary from person to person, but common signs include increased coughing, production of thick mucus, wheezing, shortness of breath, chest tightness, and fatigue. These symptoms can significantly impact a person's quality of life, making it difficult to perform daily activities and leading to decreased lung function. The role of Omnicef in treating acute exacerbations of chronic bronchitis. Omnicef plays a crucial role in the treatment of acute exacerbations of chronic bronchitis by targeting the bacteria responsible for the infection. It is particularly effective against common respiratory pathogens, including Streptococcus pneumoniae, Haemophilus influenzae, and Moraxella catarrhalis. By eliminating the bacteria causing the exacerbation, Omnicef helps to reduce inflammation in the airways and alleviate the associated symptoms. It is important to note that Omnicef is only effective against bacterial infections and is not effective against viral infections, which are another common cause of acute exacerbations of chronic bronchitis. Omnicef is generally well tolerated and has a low incidence of side effects. It is available in different strengths, and the dosage and duration of treatment will depend on the severity of the exacerbation and the individual patient's needs. It is important to consult with a healthcare provider to determine the appropriate dosage and duration of treatment. Omnicef dosage and administration. The recommended dosage of Omnicef for the treatment of acute exacerbations of chronic bronchitis in adults is 300 mg taken orally once daily for 5-10 days. For children, the dosage is based on their weight and is typically administered as an oral suspension. It is important to follow the prescribed dosage and complete the full course of treatment to ensure the infection is fully treated. Omnicef can be taken with or without food, but taking it with food may help reduce the risk of gastrointestinal side effects. The oral suspension should be shaken well before each use, and a measuring spoon or syringe should be used to ensure accurate dosing. It is essential to finish the entire prescribed course of Omnicef, even if symptoms improve before completing the treatment. Common side effects of Omnicef. Like any medication, Omnicef can cause side effects, although not everyone will experience them. Common side effects of Omnicef include diarrhea, nausea, vomiting, stomach pain, headache, and rash. These side effects are usually mild and go away on their own as the body adjusts to the medication. In rare cases, Omnicef can cause more severe side effects, such as allergic reactions. Signs of an allergic reaction may include rash, itching, swelling, severe dizziness, or difficulty breathing. If any of these symptoms occur, it is important to seek immediate medical attention. Precautions and contraindications when using Omnicef. Before starting treatment with Omnicef, it is important to inform your healthcare provider about any allergies or medical conditions you may have. Omnicef should be used with caution in individuals with a history of allergies to cephalosporins or penicillins, as cross-reactivity may occur. Omnicef may interact with certain medications, such as antacids containing aluminum or magnesium, iron supplements, or probiotics. These interactions can reduce the effectiveness of Omnicef or interfere with its absorption in the body. It is important to inform your healthcare provider about all medications and supplements you are taking before starting treatment with Omnicef. Drug interactions with Omnicef. Omnicef may interact with certain medications, such as antacids containing aluminum or magnesium, iron supplements, or probiotics. These interactions can reduce the effectiveness of Omnicef or interfere with its absorption in the body. It is important to inform your healthcare provider about all medications and supplements you are taking before starting treatment with Omnicef. Patient testimonials and experiences with Omnicef in treating acute exacerbations of chronic bronchitis. Many patients have reported positive experiences with Omnicef in treating acute exacerbations of chronic bronchitis. They have noted a significant improvement in their symptoms, including reduced coughing, improved breathing, and decreased production of mucus. Patients have also appreciated the fast-acting nature of Omnicef, with noticeable relief within days of starting treatment. One patient, John, shared his experience with Omnicef, stating, "I have been dealing with chronic bronchitis for years, and whenever I have a flare-up, Omnicef is my go-to medication. It has always helped me get back on my feet quickly and improve my overall quality of life. I highly recommend it to anyone suffering from acute exacerbations of chronic bronchitis." Frequently asked questions about Omnicef and chronic bronchitis. Can Omnicef treat viral infections? No, Omnicef is only effective against bacterial infections. It will not treat viral infections, which are another common cause of acute exacerbations of chronic bronchitis. How long does it take for Omnicef to start working? Many patients experience relief from symptoms within a few days of starting treatment with Omnicef. However, it is important to complete the full course of treatment to ensure the infection is fully treated. Can Omnicef be used in children? Yes, Omnicef is approved for use in children for the treatment of acute exacerbations of chronic bronchitis. The dosage will depend on the child's weight and should be determined by a healthcare provider. Conclusion. Omnicef is a powerful antibiotic that plays a crucial role in the treatment of acute exacerbations of chronic bronchitis. By targeting the bacteria responsible for the infection, Omnicef helps to alleviate symptoms and improve overall quality of life. It is important to consult with a healthcare provider to determine if Omnicef is a suitable treatment option for your acute exacerbations of chronic bronchitis. Remember to take antibiotics as prescribed and complete the full course to ensure the infection is fully treated. With Omnicef, relief is within reach, allowing you to get back to doing the things you love. Thanks for watching.